Hi, I'm Dr. Anton Janssen van Rensburg. Let's go through some of the other rules or the other guidelines when it comes to cannabis dosing. You are going to need experimentation with your patient. This is not just, you need 5 milligrams BD, there you go, and that's the dose. It doesn't work that way because we're hoping for microdosing, and each patient will have to find their ideal dosage. And as you can see on the screen, that sometimes you will find patients who respond incredibly quickly. And I'll share some stories, especially some of my stories with patients with seizures that responded at such low levels that even I couldn't believe it. And then some patients will need much higher dosages. Some patients with refractory epilepsy may need a dosage of more than 1,000 milligrams of CBD per day. Just other guidelines, and this is just, remember now, the titrations are preset, so you won't be left in the dark when you start prescribing. But when it comes to CBD, we like to go round about 50 milligrams a day. If this is our typical pain patient, if I'm at 50 milligrams a day, maybe 60, 70, and my patient does not feel better, then I'm going to start adding THC, and I'm going to do it very carefully. Usually I add the THC at night. I'll explain that now, at about 2.5 milligram increments. But if it's an older patient or a patient that's very much cannabis naive, never used cannabis before, then you're going to use smaller amounts of THC that you're going to add to that. When it comes to the total THC dosage, this is very important what I'm going to explain now. So the typical cannabis smoker will smoke a joint and get to a level of about 200 milligrams of THC. Some joints people can get as high as that. That is a lot of THC. With medicinal cannabis treatment, we try not to go too far over 20, maybe 30 milligrams per day. That's total dosage of THC per day, because we don't want our patients to feel strange or to get high. Your medicinal cannabis patients not taking medicinal cannabis to get high. So we start capping it off. I know some doctors go closer to 40 milligrams. That's still acceptable, but you'll see in my presentation, I try to stick to about 20 to 30 milligrams of THC. And then with my seizure patients, we may use a little bit more CBD than the 50 to 60 milligrams, because we obviously going to keep on dosing until we see the patient getting better.